In this video, we are going to talk about side effects of meditating. So before starting this video, please like this video and subscribe to our channel for the future updates. According to recent estimates, there are between 200 and 500 million people who practice meditation all around the world, depending on who you ask. According to a recent survey, approximately 40% of all adults in the United States indicate that they meditate at least once every week. Given everything we now know about the science of meditation and its larger brother, mindfulness, this is nothing short of fantastic news for the practice. Many studies have demonstrated that the practice of calming your mind. Here's a list of the 10 side effects of meditating. Let's start. Number 10. Mental atrophy. Another investigation investigating the negative side effects of meditation was carried out by Arthur Chappell, a former Maharaj disciple who was interested in the subject. According to him, the technique deprives the mind of stimuli, resulting in sensory deprivation as a result. Certainly, a large number of people will demonstrate here. There are numerous strategies for stimulating the mind and raising consciousness. When we become more conscious of our environment, we discover that we have more stimulus rather than less. This is unquestionably true for a wide range of strategies. However, it is dependent on the exact practice you are engaged in. Retreats, which require you to sit for long periods of time and concentrate solely on your breathing, deprive your brain of necessary stimulation. Long-term exposure to this can result in sensory deprivation and even brain atrophy, especially in children. As a result, many people who have practiced for extended periods of time have complained of difficulty performing cognitive activities such as mathematics and remembering names. Number 9. It may prompt negative thinking. However, it is not always the case that those who turn to meditation to assist them become more cheerful will find it to be effective. According to the findings of the 2017 study, nearly half of the participants had delusional, irrational, or paranormal thoughts as a result of meditation, as well as a shift in executive function, which is the ability to maintain self-control and complete tasks. Participants in a study done at Seattle Pacific University in 2009 reported feeling deluded as a result of meditation, which was consistent with these findings. Number 8. Movement problems. One particularly interesting study was conducted by Dr. Andrew Newberg of the University of Pennsylvania, who looked at the brains of long-term meditators. The blood flow to the posterior superior parietal lobe was shown to be reduced during meditation, according to Newberg. This is the region of the brain that is responsible for navigating our surroundings. Dr. Newberg explains that patients who have suffered damage to their posterior superior parietal lobes frequently find it difficult to move without tripping. He says that oneness may have unintended negative consequences that are difficult to detect. Blocking blood flow to the posterior superior parietal lobe results in loss of self-conception as a separate entity from other people and things around you. This can cause confusion and perhaps cause a fall. Number 7. The most shocking danger of meditation is potential death. In certain cases, there is evidence to suggest that meditation can have a serious negative side effect such as, death. While it is unlikely that it will result in death, it is not out of the question. Seizures are known to have the potential to result in death. Additionally, as we have seen above, meditation can produce seizures. As a result, there is a risk that meditation will result in death in persons who are prone to seizures. People who have a history of seizures, panic attacks, or any other psychiatric issues should check with a doctor before commencing this exercise program. Number 6. Meditation cause headaches. We all know that meditation may be beneficial in alleviating pain, yet it can also trigger headaches. There are a variety of factors contributing to this. For starters, many practitioners have difficulty maintaining mental attention during practice. The effort to alter one's mental state is greeted with psychological resistance and a wish to retain things as they are for the time being. This dispute is causing psychological and bodily anxiety among the participants, and it is for this reason that meditation might create headaches. Certain techniques, such as the third eye chakra dhyana, require the practitioner to concentrate their minds with great effort. As a result, it should come as no surprise that headaches are a common adverse effect of meditation. In the beginning, the discipline of concentrating the mind can be a difficult task. If we are not accustomed to concentrating our thoughts, the exertion of trying to do so might be uncomfortable and painful. Number 5. It might damage your sense of self. Because your relationship with yourself has a ripple effect on all of your other relationships, it may seem cliché, but your relationship with yourself is the most essential one you have in your life. Therefore, the possibility that meditation could have a detrimental impact on your sense of self is a very unsettling thought to contemplate. After returning from a meditation retreat, participants in a study performed by Dean H. Shapiro, Jr., Professor Emeritus of Psychiatry and Human Behavior at the School of Medicine at the University of California, Irvine, were more conscious of their negative characteristics, according to the findings. Researchers found that participants experienced feelings of loss of agency, loss of basic self-awareness, and a sense of ownership during the 2017 research study. Furthermore, many respondents stated that they believed the lines between themselves and the rest of the world were becoming increasingly blurred. Number 4. Feelings of dissociation. As Robson explains, meditation can enhance activity in the dorsolateral prefrontal cortex, which is responsible for regulating the limbic system, and the amygdala, which is another region that processes emotional salience, which is another location where emotional salience is processed. Prefrontal control over the limbic system, when exercised in the appropriate degree, can result in improved focus and reduced emotional reactivity. However, when it is carried to extremes, it can dull all emotions, both negative and positive, to the point where people no longer experience tremendous delight or happiness. It is possible to experience an unsettling sense of dissociation from their life in severe circumstances, as was experienced by approximately 8% of meditators in one study. Conduct a study. Number 3. It can damage your sleep. According to a study published by the American Psychosomatic Society, researchers examined the effects of a 2-month course of mindfulness-based cognitive therapy on a diverse group of study participants. The researchers discovered that people who meditated frequently, a half hour per day, 5 days per week, had poorer sleep quality than those who did not meditate frequently. Meditation, like attention-enhancing stimulants such as coffee, Ritalin, and cocaine, may increase focus and alertness, Browns-Britton stated to Robson in the BBC piece. Meditation can increase focus and alertness. However, when followed to its logical conclusion, this might result in anxiety, panic, and insomnia, due to the fact that there is both neuroanatomical and neurochemical overlap between the attention and arousal systems in the brain. Number 2. Meditation cause anxiety. You've probably heard that certain approaches, such as mindfulness, might help to alleviate anxiety. That is unquestionably correct. Many people, however, have inquired as to whether meditation might produce anxiety. And, in an ironic twist, the answer is yes. Some strategies, according to research, may actually be harmful to persons who have a history of anxiety and depression. When meditating, such individuals may experience heightened anxiety, fear, stress, panic, and depressed moods. Dr. Willoughby Britton, a neuroscientist at Brown University, conducted research that revealed that feelings of fear and anxiety are a common side effect of meditation that may be avoided. Number 1. Panic attacks. In the previously mentioned study of 1,232 meditators, which was published in PLOS One, 315 of them reported that they were having trouble sleeping. Unpleasant experiences included panic attacks, which are also known as sudden and intense bouts of fear that, according to the Mayo Clinic, trigger physical symptoms when there is no real danger or apparent cause. When panic attacks strike, you may believe that you are losing control, that you are experiencing a heart attack, or that you are about to die. According to a 2017 study, which was also published in the journal PLOS One, 14% of meditators reported suffering panic episodes as a result of their practice of meditation. What do you think of our video? Let me know in the comment section below. If you enjoy this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.